Hello.
How are you?
I'm good. How are you?
I'm good.
Okay. Oh, my name is Dr. Daniel, and I'm going to be diagnosing and treating the patient today.
Yeah, that's good.
Hi, what's your name?
My name is Dr. Sufyan.
Okay.
Yeah. So the patient, can you see the patient in front of me?
Yes, I can see her.
Yeah. This Amatullah Ibrahim. Though she's sleeping, but you can see that her mother is holding her.
Oh, okay.
She's a 4-year-old female
Mhm.
who presented with abdominal pain slash distension, fever, and diarrhea.
Okay. Thank
Yeah.
you. Could I start with asking the patient some questions?
Yes, you can go ahead.
Okay. Um, what is the patient's name? Yeah, let's start with that.
Amatullah. Yeah.
Hi, Amatullah. How old are you?
She is 4-year old. 4-year-old.
She's 4 years old. Okay. Um, where does she live? What are her living conditions like?
Yeah, they are living in an overcrowded environment, poor sanitary condition, poor water supply, and then a low income earners environment. They
Low
live,
income.
most of them live less than $2,000 per month.
$2,000 per month. Okay, thank you. Um, let's see. What is her main complaint? Like, why did she come to the doctors today? For her abdominal pain or fever?
Abdominal pain, fever, and diarrhea.
Diarrhea. Okay. So let's start with the fever. Can she describe the fever? Is it on and off, or has it been consistent?
It's on and off.
On and off. Okay.
Yeah.
Has and for her abdominal pain, um, when did she said this start? Her abdominal pain started
She said it started 3 days ago.
3 days ago, and she's also been
Yeah.
complaining about constipation and diarrhea.
Yeah. There's
Okay.
no constipation, but there is distension. She's passing her stool normally.
Oh, she's been vomiting. Okay.
Yeah.
Has she had any headaches or weakness?
No, there's no headache. There's no dizziness.
Okay. And in addition to that, has she been coughing or sneezing at all?
No coughing, no sneezing, no chest pain.
No chest pain, no coughing, nor sneezing. Okay. And okay, are her legs swollen at all?
No, there's no leg swelling.
Okay, there's no leg swelling. And you said
Yeah.
she's been vomiting. Does she have any loss of appetite?
Yes, there's loss of appetite, refusal to feed. That's what the mother said.
Okay, thank you for that.
Yeah.
So
Yeah.
I would just like to run a few tests now to
Yeah.
because I have some suspicions of what she might have, but I want to run some tests to confirm those.
You
Um,
confirm? Yeah, that's good.
okay, thank you.
Yeah.
Can you please perform an RDT, a rapid
Yes,
diagnostic?
I have done that for you. It's reactive. It's positive.
It's positive, okay. And
Yeah.
just to confirm that she doesn't have typhoid, she might have typhoid along with that. So would I be
Yeah.
able to perform a blood culture on her?
Yes, we have done a blood culture.
Okay.
Uh-huh.
Is it positive or negative for typhoid?
Yes, it's positive.
It's positive for typhoid.
Yeah,
Okay.
yeah.
So her blood culture was positive and her rapid diagnostic test was positive as well?
Yes, and we
Okay.
did a full blood count. It shows that her hemoglobin is very low, about 7.5 milligram.
Oh wow, 7.5 milligrams. Okay, that seems pretty
Yeah,
low. And
yeah,
okay. So I strongly believe I've come to a diagnosis. Um,
yeah,
I believe that the patient has malaria, typhoid,
yeah,
and moderate nutritional anemia. Is that correct?
yeah,
Okay, thank you.
yeah,
So some treatment methods for malaria include an ACT, which is artemisinin combination-based therapy. Um,
yeah,
but that's the for normal cases of malaria. But because she also has anemia,
yeah,
I suspect that she has a complicated case of malaria. In which case, I would recommend a
yeah,
blood transfusion. Um,
yeah.
because she has typhoid, I recommend antibiotics
Yeah.
to treat that because typhoid is a bacterial infection. And for her
Yeah.
nutritional anemia, because it is moderate, I recommend improving her diet with more
Yeah.
nutrient-based foods, um, such
Yeah.
as incorporating more iron, some vitamin supplements, and just getting more of the nutrition she needs. And
Yeah.
for typhoid, ways she could prevent that is through hand washing and making sure her food and water is not contaminated. Um,
Yeah.
and for her malaria, I recommend her using insect repellent, wearing long sleeves when she goes outside to prevent mosquito
Yeah.
bites because malaria
Yeah.
is a vector-borne illness. And
Yeah.
yeah, and I also recommend in her house that she gets netting for the windows to prevent
Yeah.
mosquitoes coming in and biting her
Yeah.
at night.
So what other thing would you like to do for the patient?
Oh, the other thing I like to do, I like to
Yeah.
for her to have mosquito netting in on her windows so her
Yeah.
bugs won't bite her at night.
Yes. So yes, you have done very well. I'm impressive with your performance. And
Okay.
what I will add is very simple. Next time if you're doing that, try to educate the patient.
Okay.
Yeah, educate him. Try to make him understand what malaria is really is,
Mhm.
what typhoid is, and then what nutritional anemia is. Because by knowing what the condition is, it will help you a lot, and even the patient also, on how to 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 prevent further infection and then further complications.
Okay. Yeah. Thank you.
Yeah. So now next time, try to educate your patient. You have done very well. I'm impressive. My patient here also is very impressive on your performance, and is
Okay.
saying hi to you.
Hello. How are you?
Yeah, thank you.
I hope
So
you
now
feel
please
better.
take it. Yeah, she's still feeling better. She's feeling better.
Okay.
Yes, thank you.
Okay. Thank you. Tell the patient I
Yeah,
hope she
thank
feels
you.
better. And everything
Yeah,
goes well.
yeah, thank you. Thank you
Okay.
very
Thank
much.
you.
Thank you, Dr. Daniel.
Thank you, doctor.